katone
Government of Uganda, the Kabaka of Buganda, various organizations and international bodies have all participated in the fight. But the resurgence we see today is a reminder that perhaps we have not done enough. This country is indebted to all who have participated in this fight. But please do not give up. Let us stand up and give HIV AIDS the blow that will kick it out of our country.
Your Excellency, the other indicator that I would like to report progress on is new HIV infections. Your Excellency, by the end of December 2022, we usually, working with the data from Ministry of Health, we look at data for 1 year. We recorded 52,000 new infections. A slight reduction from again what we reported to you in Rukunjiri. In Rukunjiri, we told you that we had recorded 54,000 in the previous year. So we reduced by 2,000. We can do better because, as you've told us, we shouldn't have new infections at all. That is the target by 2030.
Your Excellency, linking and inclusion with special emphasis networks of adolescent girls and young women and young people affected and living with HIV to government wealth creation projects like the parish development model and policies and budgets to curb adolescent girls and young women economic and education exclusion. Your Excellency, keep adolescent girls and young women in school to scale implementation of prevention interventions among adolescents and young people, including adolescent girls and young women, provide supportive legal and policy environments for uptake of prevention-related services.
I myself have been on treatment for over 20 years, and although I had AIDS, suffered from cancer, from some of the very bad diseases, I'm now okay. I was dying at 47, now I'm 70, and as you can see, I am very healthy. The environment that you have created has helped us to do a lot, but we still have a challenge. We are told by Uganda AIDS Commission, and we know it's true, that there are over 1,000, about 1,000 Ugandans are infected with this disease every week. We want this to stop. It is not in our interest as people living with HIV who are already infected to have more people getting infected, because this jeopardizes our lives. We want all people who are already infected to be able to live healthy and age gracefully with HIV like I am, and die of old age eventually, not of AIDS. Mwebale nnyo okuja mu bungi bwe muti. Amanya gange nze Dr. Stephen Watiti, ndi musawo mutendeke, naye ndi omu ku abo abalina akawuka akaleta mu Kenya. Mu 1999 nali mulwadde nnyo nga nina kansa, na TB, bakafuba, n'emulalama. Naye nga bwe mundaba, ndi mulamu kati sirina obulwadde bwonna, era mmira ddagala lyange ndimbira ku time. Kye njagala nammwe abaliwo naddala abo abamanyi nti mulina akawuka mulabeere nti mwewandiisa mumire eddagala nammwe abataba kwekebeza mugende mwekebeze leero. Tetwagala muntu yenna omulala afuna akawuka, twagala kye bayita zero new infections. Nooti tetwagala muntu mulala afuna akawuka. Ekyokubiri, tetwagala mwe abakalina gwe nange abalina tufune obulwadde nga TB nga kansa n'obulala ne butuuta abantu bakyafa. Ekisembayo njagala tukole tuyige ebikwata ku siriimu, tulebe kusosola abantu oba okwesosola. Ebyo bye bange bannange nebaza nnyo olw'okumpuliriza. Mukama abawe omukisa.
In the implementation of our programs, we continue to prioritize primary HIV prevention interventions. In 2023, we intensified social behavior change communication programs. Working with partners, we have utilized multiple media channels to reach to the public with HIV prevention, care and treatment messages. The key prevention methods have been explained, including our ABC+D messages. As part of the World AIDS Day, the Ministry of Health implemented a number of pre-World AIDS commemoration activities, which the young girl here has already mentioned, and so I'll not delve into that as well, due to time constraints. The prevention of mother-to-child HIV transmission remains a key priority for the Ministry of Health. In this program, we continue to focus on 4 critical prongs, which include primary HIV prevention among women of childbearing age and their partners.
Excellencies, sir, every year on 1st of December, the world commemorates World AIDS Day. People around the world unite to show support for the people living with and affected by HIV and to remember those who lost their lives to AIDS. The world can end AIDS with the communities leading the way and with excellent leadership like yours. Today, after 4 decades of AIDS, we are not only celebrating the World AIDS Day, but we are recognizing Rakai as the epicenter of the AIDS pandemic before it was described in the entire country. We are celebrating the NRM government's achievement of fighting this calamity and proving to the world that it can be put to an end. It is here in Rakai that the terrible face of this disease was unveiled. Excellencies, sir, I welcome you to Rakai and thank you for finding time out of your busy schedule to come and officiate at this important day.
I congratulate you, Your Excellency, and all the people of Uganda on the commemoration of the International AIDS Day, 1st December 2023, under the theme, Ending AIDS by 2030, Keeping Communities at the Center. Your Excellency, this theme resonates very well with your commitment and deliberate interest in ensuring that all Ugandans are healthy. Through a range of sustainable interventions over the years, including immunization for all, advocacy and awareness creation whenever there is a challenge, where you participate personally through the TV or the radio. Thirdly, preparedness in the fight against epidemics, preparedness against viruses and bacterial diseases, and well-laid strategies, Your Excellency, in the fight against malaria, and the provision of health infrastructure across the country, together with equipment and the human resource.
Okusomesa okwange kuli ku nambeemu mwewale akawuka kano. Bye mwogedde wano mpuliddemu akagambo abaana abalina ebizibu obutabeera mu masomero nti be basinga okukwatibwa akawuka kano. Naye ekyo nakyo kivudde mu bujeemu bwammwe bw'abantu bammwe, kubanga 96 nze nabaleetera abaana bonna basomere bwereere mu masomero ga gavumenti. Naye no wansi enkola eyo mwagiremesa. Abakulu b'amasomero n'abakakiiko k'amasomero bakomyawo ebisale mu masomero ga gavumenti. Ebisale ebyo bye bigoba abaana mu masomero. Kati abaana bemugoba mu masomero be bano bemugamba nti bakwatibwa ku myaka 15 simanyi bikyabo bebo. Songa jjajja w'abaana Uganda, jjajja w'abaana bano abazzukulu bano yali asazeewo nti abaana basomera obwereere. Singa mukirize ekintu ekyo ne muva mu bujeemu ne muwuliriza bye mbagamba, tewandibaddewo abaana abalemeddwa okusoma nti kubanga tebalina bisale, nti kubanga banaku. Ekyo twandikijjeewo. So awo ne tunyweza eri ensomesa eya kubanga bw'ava mu ssomero talina muweerera kwe kutandika okwekwata bino ebisajja ebikadde ebyalwala dda ne bimusiiga. N'olwekyo bwe mba mukkiriza muddeyo ku nkola yange abaana basomera obwereere mu masomero ga gavumenti. Tuwabangawo aleeta ebisale mu masomero ga gavumenti. Singa mukola ekyo omuziziko ogwo mba mugugjeeko. Kati eyo nambeemu, okwewala nambeemu, omukulwana kwaffe mwewale akawuka. Abaana bonna mubasomese kuva mu buto mu masomero ga primary mu maka nti okwewala kusinga okwerinda nokukira okutambirwa. Kati bwe tuva ku ekyo ne tusanga nti eky'omukisa omubi waliwo akwatiddwa akawuka ako, oba okuva kati saagala omuntu omupya akwatibwa akawuka kubanga tukimanyi gye katandikira gye kava. Naye bali abakwatibwa akawuka bo bakozesa eddagala ng'abasawo bwe basomeseza wano. Era njagala kwebaza abantu nga Dr. Watiti n'abalala kubanga batuyambye okulaga nti kisoboka wadde akawuka kamulumba asobola okuwangaala mu bulamu ne kimuwa omukisa okukuza abaana bazadde ne bakula. Abanyankole bakyeta okunyeetsa abaana n'okukola emirimu okutuuka mu myaka gy'obukadde. So awo kwe kulwana okwokubiri. Nambeemu kwewala. Namba 2 okuwangaaza obulamu, tugoberera okuwabula kw'abasawo mu by'okukozesa eddagala.
olwaleero nze ebyange biri bibiri. Namba emu, okwewala. Namba bbiri, okuwangaaza obulamu eri abo abakwatibwa akawuka. Mbyokwewala ekigambo ky'abaana abato, kubanga mulabye nti abaana abato be basinga kukwatibwa akawuka ako, ate ekibaleetera akawuka nnaku z'omu maka, obwavu. Kati nze kyenteesa nti tubagireko ekizibu omuziziko ogumu, obutasoma. Abaana bonna abanaku basomere obwereere mu masomero ga gavumenti nga bwe twakitegeka, kigenda kujjako ekizibu ky'amaanyi. Abaana bagenda kubeera mu masomero ne tubabuulirira ne balaba nti bagenda obulamu bwabwe bulina gye bulaga. I think it can contribute. Originally, this virus took us by surprise. We didn't know where it was coming from initially, but within a short time we knew that it was coming through sex. And from that time we told people that you can easily avoid this problem. And when they do, it works. It doesn't spread. It doesn't go through handshake. It doesn't go through breathing. It goes through sex. Or originally, it was also going through blood transfusion before we had perfected the checking of blood. So I was now challenging them that now that we know where it is coming from, why is it continuing to spread? But from the data, it seems part of the problem are the young people, 15 plus, who are desperate for life. And they surrender themselves to people who infect them. That's why I proposed to them, and they seem to like it, that please, one of the loopholes was your refusal to implement free education, primary and secondary, in government schools. If you did that, you would liberate these young children from that dependency on other people prematurely. And they seem to like it. So please, let's take it as part of not only capacity building for the youth, but as part of the anti-AIDS measures. The children to go to school, be looked after by Uganda. The Republic of Uganda should be the one to look after the children of the poor homes, poor families, by providing free education. And they seem to like it. And then, so that was the first effort. Prevention by talking, but also by removing some of the hard roads, like this one of young people being stuck and being vulnerable. Then through the other programs, the Myoga, the PDM, the families should be able to get income and have the children not so desperate, trying to sell themselves in order to solve the problem of livelihood. Then the second cluster of measures was that in case, for those who already have the virus, then the good thing is that now you can live for a long time, taking the ARVs, provided you take them properly. And then the women who are pregnant, they take the other one which stops mother-to-child transmission. And in that way, It will reduce transmission, but also prolong the life. But you must take the drugs as directed by the medical people. But one of the points I wanted to clarify was to remove the idea that if you are taking ARVs, you can live a totally full life like the one who is healthy. According to what we have observed in the army, and these doctors confirmed it, that's not the case. When you expose the body to rigorous exercises in the army, I have seen a number of cases where people break down. I don't know whether they improve, these new medicines have addressed that, but we lost quite a number of commanders when they went into battle. While they appeared to be all right, but when they went into this hard army life, field life, their systems broke down. So therefore, really to get full value of your, full potential of your life, avoid this kauka. That is my message. The other one is a fallback position. If you have a problem, then you fall back on this position.
This message was prepared by Uganda AIDS Commission on behalf of the people of Uganda to His Excellency General Yoweri Kaguta Museveni, the President of the Republic of Uganda, in recognition of his exemplary leadership in the fight against HIV and AIDS in Uganda at the commemoration of the International World AIDS Day, December 1st, in the year of our Lord 2023, at Chibale in Rakai District, Uganda. Your Excellency, I take the honor on behalf of the people of Uganda to extend our sign of gratitude by that prestigious award that is being brought forward.
In the fight against AIDS, his leadership since 1986, where he has led the leadership within government and the leadership within the Ministry of Health, and through the Uganda AIDS Commission, prestigious award, the HIV Impact Award. In those categories, a technical committee was composed of experts in the HIV and AIDS sector. They did evaluate the nominations, and these are the selected winners for the awards in those categories mentioned, Your Excellency, and these are the 14 recipients representing the individuals, institutions, and also the corporate companies under the private sector who are receiving these very prestigious HIV Impact Awards. I will ask that the Director General of Uganda AIDS Commission stays with the group, and we can now invite you, Your Excellency. Bana Rakai bana ikatuba wengalo bano be ba champion bafe baguno mwaka zina awards zetu ise HIV Impact Awards with HIV. So may I welcome Bishop Joseph Tumweba.
Starting a multi-sectoral approach in HIV response, rather to fight stigma and end HIV by 2030.
Threat in Uganda by 2030. Dr. Nelson.
Our esteemed President and invited guests, today,
for the Most Reverend Stephen Eberomwenda, okwezi ku 12 ezikuyinza wekitiibwa tumobilizinze region yo ne Kampala byatuuka radio zonna ziranga mwembuliridde enjiri owekitiibwa
of Uganda for your statement on this. And Dr. Stephen, they told me you're very youthful, you know how to run.
N'olwekyo abalonzi gye mpita bambuuza kai tetuyinaamu yadde kkolero nalimu His Excellency amazzi agafukirira ag'okkozesa awaka n'ebisolo. Amakubo bwe ganaabeera amabi, omukyala oyo bw'azaalira ku kkubo wabeerawo Oweekitiibwa
Ekisembayo Sebo.
Kansembeyo Matovu Waswa Edward, Chairman LC1 Lucha.
Chairman LC1 Owechitundu. Your Excellency the President Yoweri Kaguta Museveni, we want to appreciate you for joining. I want to appreciate the protocol and recognize Her Excellency the Vice. I do recognize the honorable ministers present here, the heads of our government agencies, our religious leaders. Day. Your Excellency, we have a few speeches. It's a very short statement to make on behalf of the Interreligious Council of Uganda.